with a doctor, but I'm sure in your different pediatricians' offices, probably half of you, the pediatricians that you go to already have PAs in their offices that you've seen from time to time. So a doctor goes to medical school, goes to college for 4 years, conventionally goes to medical school, then goes on and does a residency, and depending on how subspecialized they want to be, they spend different amounts of time in the residency. It's at a minimum 3 years. Urology is, you know, because you lived through it with your father in Rochester, right? Yeah. No, urology is 4 or 5 years? 4 or 5 years, okay. It depends. Neurosurgery is 7 years. So with a varying amount of training, and then you get out, and then you're a full-fledged specialist in whatever area that you're in. For instance, my field, I became a cardiac electrophysiologist. I did it a little bit differently, and I'll explain that to you later. But in total, the way it works to become an electrophysiologist is you've got 4 years of college, you've got 4 years of medical school, you've got 3 years of general medicine residency, you've got 3 years of general cardiology fellowship, and then you've got 1 or 2 years of cardiac electrophysiology fellowship. So of course that's a very long training program. So again, had I done it conventionally, so I graduated from Flatbush, I was 17 years old, 4 years of college, I'd be 21, 4 years of medical school, I'd be 25, 3 years of residency, I'd be 28, 3 years of fellowship of general cardiology, I'd be 31, a year of EP, I'd be 32, and then when I get out at 32, and I'd start earning a living. If you go to PA school, okay, some of the programs have changed, and I'm not a PA, and I'm not a representative from a PA school, but the way I understand it these days, I think at a minimum it's 5 years. So you graduate, you're 17, 18 years old, it's 5 years, you're 23 years old, you're out, you get a job. In whatever field you want to get a job in. You want to be in a pediatrician's office seeing kids, you can do that. You want to do something really high tech and be with an orthopedist and repair people's hips, you do that. You want to come with me and be an electrophysiologist and take care of people with heart rhythm abnormalities, you do that. So, with I said I would have conventionally gotten out at 31. As a PA, you'd get out at 20, what did I come up with, 23? So, something like that. So that's 8 years, which is a really long time. And that's 8 years of income that you're going to be delaying. You don't get paid nothing in your training, but it's certainly less than what a PA makes. And I'll give you the example. So I hired a PA in the office a couple of years ago, and she actually went to a 4-year program at St. John's, which I believe doesn't exist anymore. I think now at a minimum it's 5 years, but she went to a 4-year program. Okay, so I hired her, with a good salary, between salary and benefits, we're looking at a 6-figure income. And my friend Mitch, who was my insurance agent at the time, I said, Mitch, look, you call her, make sure she has her health insurance, whatever she needs. So, okay, good. So I hired her thinking like a doctor. How old is she? Okay, whatever, she's 25. Mitch calls me back, I said, by the way, you know how old she is? I say, no, he says to me, she's 21. So at 21, living with her parents, she's got a job where she's making, a 6-figure income. I will tell you this, as a doctor, it's going to take you a really long time to catch up to that. Meaning financially, you're at the age of 21, forget about it. You're still in, you just finished college and you're applying to medical school. So for the next 4 years, you're going to be paying medical school tuition, $40,000 a year, and living expenses and all that. And then you would be in a residency program and perhaps a fellowship. So that's a lot of years where you're not earning the income that otherwise, if you were a PA, you'd be earning. And so if you're talking strictly financially, it takes a long time. If you're going to become a doctor, it will take you a long time to catch up financially until, financially it becomes worthwhile for you to become a doctor rather than a PA. So I just wanted to point that out, for people that are considering the different options. Now, of course, as a doctor, I'm much more independent. A PA works with a doctor and cannot work independently. As a PA, you will always be a PA. You will always be a physician's assistant, whereas a doctor works independently. And so that's something that you have to consider. There is that trade-off. You know, you have to accept the fact that you will not work independently, that you will always work with a doctor. But I'm a great guy, and you know, Elaine, the PA in my office, I think she enjoys her job. I think I'm a lot of fun to work with. You know, we learn new things every day. So again, those are the positives and negatives of being a physician versus being a physician's assistant. Anyway, oh, you know what? I'll mention another thing. So Sophie Davis is up at City College. People have heard of City College. It's in Manhattan. It's in Harlem. It's on 138th Street and Convent Avenue. And so I don't think things have changed there all that dramatically. And something that I'd like you all to think about as you go on to college is how you're going to respond to the college environment. This is a completely other topic, and it's not something that I was brought here to discuss, but I will tell you that when I showed up at City College for my first day, there was a big sign hanging outside. They had a bridge that was going from one building to the other, and the sign said, "Run, Jesse, run," meaning that Jesse Jackson was running for president at the time, and it said, "Run, Jesse, run." And the other thing that Jesse Jackson did at the time was he called New York City Hineytown. You know, you guys aren't old enough to, you guys weren't around at the time, but he referred to New York City derisively as Hineytown, meaning there are Jews there, you know, and it was a very derogatory thing to say. I mean, imagine if a Jew said something comparatively about black people, you know, the guy would never see the light of day. So this was the environment that I was in. You know, it was a somewhat anti-Semitic, certainly, I would tell you it was more anti-Semitic than it was anti-Zionist up at City College in the day. And you have to think now how you're going to respond to these things when you're on the campus. Mrs. Hanna, do they talk to?
Yes,
they do talk
yes,
to
clubs.
You know, I would say this. You know, of course, I'm a fighter, so you know, so I fought and I wrote letters to the newspaper, you know, and that's how I decided to deal with it. And it takes a fair amount of your time, and I would not have changed a thing that I did. But that being said, if you're not a fighter, that's okay too. But you gotta think what you're going to do before you get there, because you're going to be confronted with these things. Unless you'll go to YU or Touro or I suppose Queens College, you know, is a pretty nice environment. But Brooklyn College is rough. You know, City College, I'm sure, is still pretty rough. Hunter, I know, is a jungle. Baruch's probably not so great either. You know, and forget about Columbia and Varner. In terms of the environment you're going to face, you know, if you went to Varner, Columbia, right? Well, it's probably a little bit better in your day, but it's a very rough environment to be in. You got to decide now how you're going to want to react to that.
Dr. Berger, can
Yes.
you tell them a little bit, they're here to hear a little bit about the resume builder, like what you did to further your interest in medicine?
Okay, so I can really only speak for getting into Sophie Davis from high school because that's what I did. I didn't really do anything else. And my understanding of getting into Sophie Davis at the time, and I think it continues to this day, of course, grades are important. You know, an emphasis on your performance on the different regions, including math, not just science. An emphasis on your performance there, because I guess that's how they can compare you to students from other schools in New York City. You know, as opposed to just your grades in class, but a Flatbush, of course, is more competitive than, let's say, your average public school. So your performance on regions is very important for Sophie Davis, number one. And then number two, you have to show an interest. And particularly, it seems to me, again, for Sophie Davis and probably for a lot of these other programs, it would entail getting out there and getting into a hospital and volunteering. Coney Island Hospital, which is pretty accessible to everyone here, had a very active, extensive volunteer program back in my day. I don't know if it's still to the degree that it was.
They still do, and so does Maimonides.
Right.
Yes.
It seems to me, though, that if you had to pick between the two, Coney Island Hospital might be better because, of course, Coney Island Hospital is a Health and Hospitals Corporation hospital. Maimonides is a private hospital. And I think if you want to demonstrate yourself to be somebody who's interested in communities beyond your own to be at Coney Island Hospital, where they're often taking care of people that can't afford care, immigrants. It seems to me that makes more of an impression on an application to a college or a program that's not, let's say, Yeshiva University or Touro. So I would emphasize.
And we can help you do that.
Right.
If that's what you're
Yeah, I would emphasize volunteering, particularly at Coney Island Hospital, as a good activity if you're interested in anything in the medical field, whether you're interested in being a doctor, a PA, a physical therapist, occupational therapist, nurse, dentist, hygienist. I think all these healthcare fields, volunteering at Coney Island Hospital, you can't go wrong. There'll be situations that come up that you can talk about on an interview and explain how you dealt with them. I think that would be a very good use of your limited time, right? Because it's one thing you go to public school and you're in school from 9 to 2, right? And then you got the whole afternoon and you can volunteer here and there. Of course, here you're in school and the yarn starts at 7:30, right? And you get out at 5:30, 6 o'clock, you're dead at the end of the day. What volunteering are you going to start to do? You know what I mean? So your time is limited, and I think you'll get the most bang for your buck getting into volunteer at a hospital, particularly a place like Coney Island Hospital. So anyway, so actually I only had a couple of things to say just in terms of...
And then they have questions that they want to ask you.
Okay, great. So just in terms of how I went about things, so I finished the program, I finished my final 2 years at Downstate. That's how Sophie Davis worked back in the day. Today it's actually all 7 years are through the program up at City College, but back in my day you matched to one of 6 or 7 different medical schools for your final 2 years. So I finished up my final 2 years here at Downstate, and it was 2 excellent years. I teamed up now with a couple of my classmates from Flatbush, Jason Sperling, Renan Kazami, and there was somebody else, I forget who was like a year ahead of us in our year. Anyway, it was great. But the problem is, unless you've got a doctor or a mentor who is a doctor available to you, so unless you have a doctor in the family or you have somebody that you're close to who's a physician who can really guide you through this process, you're going to get to medical school. You're going to see all these fascinating things. One day, you're going to see fascinating urologic surgery. Another day, you're going to see a pacemaker being put in and inflation. And another day, you're going to see a baby being born. And another day, you're going to take care of a newborn baby in the ICU. So you're going to see all these amazing things. Okay, and then now you got to decide amongst all those different fields. You can no longer say I want to be a doctor. You got to decide if you want to be an orthopedist, a urologist, a cardiologist, and you got to decide quickly. And that was difficult for me because I don't have any doctors in my family, and I didn't have anybody close to me really as a guide. So in that sense, I would say I was on my own. And what I would like to impress upon you is you've got to find mentors out there that are going to guide you with what you need to do. It's not enough to rely on whatever school you go to, because the people at the school don't necessarily have your best interest at heart. And I'll explain to you what I mean by that. The school, so let's say you're finishing up with medical school, and like me, you're not really sure what you want to be. You think maybe you want to be a gastroenterologist, which was the case when I was in my last year of medical school, but I really had no...
Just a reminder, this morning's class begins at 8:40. First period begins at 8:40. Please make sure everyone, let's get to class by 8:40.
But I really had no idea what I wanted to be. I thought maybe being a gastroenterologist, but I wasn't certain. So you go to your dean, okay? And the dean, they want to help you. My dean was a nice lady. She was definitely helpful and kind. But her goal is to make sure that you get into a residency. She doesn't care what you want to be. What she wants to be able to say is at the end of the year, 99% of our graduates got into one of their top 3 residency choices. But you might have gotten into your top choice, but actually you didn't want to be a pediatrician, just you had no guidance. You really wanted to be an orthopedist. So now you're going to go on and become a pediatrician when in fact, that wasn't what you were interested in. So you really have to find mentors out there to guide you, and it doesn't necessarily have to be in that field. In other words, if let's say you decide that you want to be an orthopedist or a sports medicine doctor, of course, ideally, yes, find a mentor who is an orthopedist or a sports medicine doctor, but if for whatever reason you fall in with somebody who is a gastroenterologist, they've been through it, they can guide you and give you good advice as to how to achieve your goal, and also to help you get involved in a field that is most appealing to you. So again, I would stress having good mentors as being very important. So let me just tell you one final thing about how I went about things, and then I'll be open to questions. So what I wound up doing was I went to Beth Israel and I did 3 years of general internal medicine. I went with the intent of becoming a gastroenterologist. The normal way you become a gastroenterologist is you do 3 years of general internal medicine, then you go into a fellowship for gastroenterology for another 3 years, and then you're a gastroenterologist. But for different reasons, I decided not to become a gastroenterologist, so here I am now at the end of my 3rd year of residency, married with a baby on the way, and I didn't know what else to do, so I became a general doctor, and I actually had a practice here on Avenue J for a number of years. Over the years, I realized that really what interested me was the cardiology, so I actually did something that is pretty not very common. Which is after a certain number of years in practice as a general doctor, I went back to do the fellowships in cardiology and in this subspecialty of cardiac electrophysiology, and then I got back out after spending those 4 years in fellowship, and I reopened my office here on Avenue J. But I must say, it really was the smartest thing I did for myself, because I've never been more satisfied professionally in that. At the same time, I'm able to take care of my community, of my friends. I'm able to be their doctor. They need something, I'm there for them. But at the same time, being a subspecialist, I have access to all these fascinating technological advances. And it's just a very interesting, very exciting field. I do procedures here. I do procedures at the Mount Sinai Beth Israel in the city with Sam Hannon. And it's just a fascinating high-tech field, and that's perhaps something to discuss when you're a little further on in your training as to what to do. But again, it was a very good decision on my part, and what I want to impress upon you then is, let's say you get out there and you get into a field, whatever it is. Let's say you don't even decide on medicine. You're a teacher, or I can't think. And you decide that there's something else that you want to do. Sometimes it is too late, but certainly early on in your career, it's not too late. If you decide you want to get more training to do something more specialized, I would strongly encourage you to do so. That's all I have to say for now, and now I would like to entertain any questions.
Go ahead. Raise your hand or you're ready to ask a question.
How did you decide what type of doctor you want to be? Decided on that.
Right. So you know, in retrospect, there is a process that sort of led me to this. You know, the truth is, when I was sitting here in 1987, deciding to be a doctor, the field of electrophysiology didn't really exist. Okay, a lot of what we do is ablations. Okay, which is a procedure whereby we put catheters to the heart to find certain areas of the heart where there's abnormal activity, and to go ahead and deliver energy to that area. That technology didn't even exist in humans in 1987. So there obviously was a path where I went down it and decided, okay, I don't want to deliver babies. Okay, then you know, dealing with kids, I very clearly remember. I don't want to be a pediatrician, not because I don't like kids, but because I like kids too much. I couldn't do procedures on them. I couldn't even give them shots because I just like kids too much. So I knew I couldn't be a pediatrician. So I knew then, you know, I'd be headed to something in adult medicine, and then just different things fell by the wayside till I realized that yes, I wanted to do something in general internal medicine. And again, the two big fields when guys go into general internal medicine, which is probably, if you look at any graduating class of medical students, that's probably the largest number. The largest number of students go into general internal medicine, and then out of general internal medicine, then The largest two specialties that are taken are gastroenterology and cardiology. Those are the two big ones. The other ones, for instance, so you've got, I might be leaving some out, but the two big ones, gastroenterology and cardiology, you've got pulmonary diseases, you've got allergy, you've got infectious diseases, you've got rheumatology, you've got kidney diseases. Those are all subspecialties within internal medicine. Now, you might say, wait, what about, think of a name, think of a doctor that I didn't mention yet. Dermatologist, good. What about a dermatologist? What about a urologist? Or what about a neurologist? Okay, so those are different paths. You take a different path to become those kinds of doctors. A dermatologist is a residency program that you have to decide that you want to do early on, and it is a highly selective field to get into. Really only the top people in the class wind up getting slots in dermatology. What did I say? Neurology also is its own field. You have to decide that you want to be a neurologist straight out of medical school, and then you go into a neurology residency. Did I say urology? Urology also is its own field, it's its own match. And again, you have to decide that you want to be a urologist and go straight into that. It's something that urology actually is something that I considered, but then I decided not to, because it seems to me that in urology you really are dealing with one type of patient. You're really dealing with older men, with different problems. And I wanted a broader practice, which is why I decided to do it.
Dr. Berger does electrophysiology, which you understand what that is, putting in pacemakers.
There's about different doctors about plastic surgeons.
Okay, so plastic surgeon, I'm glad you brought that up, and I'll explain to you why. A plastic surgeon, so then you've got the surgical subspecialties, okay, and this gets a little tricky. You got the surgical subspecialties. What that person did was, they decided they wanted to be a surgeon first, okay? And so they went the track when they finished medical school, they got a general surgical residency, okay? And then, within that general surgical residency, they decided to subspecialize in plastic surgery. Just like I, as a medical doctor, I have decided to subspecialize in cardiology. The plastic surgeon, for the most part, went into a surgical residency, did a few years of surgery, and then subspecialized in plastic surgery and finished as a plastic surgeon. I may be a little bit off on that because it might be that there are also plastic surgery programs just like becoming a urologist, where you decide, no, I want to be a plastic surgeon. So from the get-go, you enter a plastic surgery program, you do, let's say, 2 or 3 years of general surgery, and then you continue on for another 2 years or so of plastic surgery. The other specialties within surgery are, so you've got general surgery. I believe you can do a fellowship these days in laparoscopic surgery, which is operations where you don't make a big cut, you just make holes and you stick in cameras, to look in different areas. Plastic surgery, cardiothoracic surgery, colorectal surgery. Yes.
I know you discussed the BAMD 7-year programs, but also I know there are programs that offer 3-year medical school guaranteed residency programs. I know NYU has a program. Can you just discuss the different benefits of those programs?
So that's hot off the press, right? That's a very new idea. There are people out there saying that the training is taking too long, okay? I think that's crazy. I think the training is taking too short. You know what I mean? There's so much to learn. But there are people out there that are saying that the training is taking too long, and so we want to expedite people getting through medical school, and they're trying to shave like a year off here and there. I think that's nuts. I don't understand it. But I guess if somebody's a genius, you know what I mean? And I guess that's who's going into these programs. They can do 4 years and 3 and then move on. There was also talk about shortening the training to become a cardiologist, that somehow instead of doing 3 years of general medicine and 3 years of cardiology, to somehow make it like a 5-year program to become a cardiologist, because they're predicting a shortage of cardiologists in the future.
Those programs are usually beneficial because, say, you want to get into a tough residency, like, for example, dermatology. So basically that program would help you get into a guaranteed residency.
So I don't know if those programs are looking to crank out more dermatologists necessarily. I don't know.
It's a guaranteed residency program that they offer.
Yeah, but, right, but they might be guaranteeing that you'll become a general doctor, because that's what we really need. You know, the population's getting older, you know, and there's more and more subspecialization. But I think that the highest need is for general doctors. And I wouldn't count on, you know, look into it, but I wouldn't count on them caring to make another person a dermatologist. I would count on them trying to crank out, you know, more general medical doctors to get out in the community. But I don't know enough about it to speak for it. Yes?
Is there a difference between going to a private medical school than to going to a public, like state school?
That's a great question. Of course, I'm biased. You know, I went to CUNY City College, I went to Downstate, and so, you know, of course, you know, the brand is always more impressive than the generic, right, in life. I remember as a kid getting we got the Kiefer brand lemon juice instead of the real lemon juice, and I remember telling my father the real lemon tastes better, but the reality is you can't tell the difference. So, you know, the brand is always more impressive than the generic. That being said, going through any American medical school is an impressive accomplishment. And so, sure, if your aim is to be the chief of medicine, you know, at some institution, having come from an Ivy League school, having gone to an Ivy League college and gotten into an Ivy League medical school and done a residency at a very impressive program at, let's say, Brigham and Women's in Boston, you know, yeah, that looks a lot more impressive than somebody who went to Brooklyn College and downstate and did his residency at downstate and his fellowship, you know, at Kings County or at Brookdale. So it is more impressive, but in the end, for the average doctor, I mean, if you look at the doctors practicing here in Brooklyn, very few of us went to Ivy League schools. The majority of us went to downstate or to Einstein, and you know, they'll give you an excellent education. Certainly much more value for the dollar in terms of the education itself. But I can't deny, you know, you see on somebody's wall that he went to Harvard, he went to Columbia. You know, it certainly is more impressive than somebody who went to a state school. But in the end, I really think it's not going to make a difference for 99% of the doctors that are coming out of the sheet of